Hi, I'm Dr. Kenneth Thean, and today I'll be talking about skin firming and tightening treatments and the non-surgical facelift. I'm 61 years old and I wanted to age gracefully. So this is the result of many years of studying and educating myself on what the non-surgical options are. This is what I do for myself, and when I see a patient that asks me, Dr. Thean, I'd like to look younger, I tell them, you have to look at three areas. The epidermis is the upper layer of skin, and this is the layer that people look at. So the first thing I wanted to do was to change my skin from rough, spotty, dull, to bright, clear, radiant, take away my pigmentation and give it a smooth texture. So that's one. The best way to treat that? Medical lasers. Once I've achieved that, the second thing I want to do is to treat the dermis. Now the dermis is the deeper layer, the second layer of the skin, and we know that once we hit adult life, we lose 1% of our collagen and elastin a year. So it just goes down. But collagen and elastin can be built up. Just like you go to a gym and you exercise, you get muscles. Energy-based devices go into the skin, stimulates the production of more collagen, more elastin, and we look younger. Now, how do we do that? Research has shown that when energy-based devices like medical lasers are used, the first thing that happens is collagen contraction, and so the collagen fibrils become firmer, thicker, and the elastin more springy. It then causes the attraction of more fibroblasts to the area through secretion of cytokines and heat shock proteins. These chemical mediators also make these fibroblasts grow more collagen and more elastin. So the next thing happens is more fibroblasts attracted to the area and working harder. In about 3 weeks' time, another chemical mediator called CDP1 makes these immature type 3 collagen fibers change into type 1 collagen fibers. Mature collagen fibers are stronger, more stable, and therefore they last much longer. Two very common questions I get asked. When should I start? And am I still able to produce collagen as I get older? And I tell my patients, the earlier you start, the better. Because when you're young, your capacity to stimulate collagen is greater and you build up more over time. The second question is, when will I stop growing collagen? And I tell them the body's capacity to repair is amazing. And even an 80, 90-year-old person who gets cut will still heal. So you will always produce collagen. The difference is you're going to produce less and slower when you are older. Now that we've thickened our dermis, the next thing we want to do is to lift. The skin is attached to the muscles and to the bone by ligaments. As we age, because of gravity, the skin goes down and these ligaments lengthen. If I can shorten these ligaments, the skin lifts. We use the same mechanism as I described for dermal thickening, but only this time we use a different technology. We use high-intensity focused ultrasound, or HIFU for short. Ultrasound can go deep to the skin, and traditionally we use 1.5, 3, and 4.5 millimeters deep to the surface of the skin. And the mechanism of action is exactly the same as what I described for dermal thickening. The only difference is it's at a different layer. The first HIFU machine was introduced in 2009 and it's a mature technology. Unfortunately, the early machines were painful. The latest technology by the Swiss is to take that same HIFU beam and split it into 1000 Hertz, 1000 times a second. So before your nerve can say, ouch, it's moved on. And it comes back again, and you get really good results without pain. For optimal results, you need to treat the epidermis, the dermis, and the smas. I do hope you liked this educational video and that you find it interesting. For more information, visit my website at www.ensoulclinic.com. And if you like my video, please press the subscribe button.